Go.
Hello everyone, Dr. Rajiv this side. I'm an MBBS gold medalist and also a resident cardiovascular surgeon. Today's topic that we're going to talk about is Takayasu's arteritis. Takayasu's arteritis is one of the two most common giant cell or large vessel disease. In surgery, we classify the diseases on the basis of how large the arteries are. So, large vessel disease is when aorta and its branches are involved. Then we have medium-sized arteries or vessels disease, and then small vessels disease. So, two large cells disease are or large arteries diseases: giant cells arteritis and also Takayasu's arteritis. I'll explain you Takayasu's arteritis. It's idiopathic. The etiology is unknown, and nine females have them and one man. So 9:1 ratio, and it's most common in Asiatic predisposition. So it's very commonly seen in females who are Asiatic, and the most common thing is it's seen in the women who are less than 40 years of age. But giant cells, the same thing, but almost the same thing, I mean, but they are elderly women. Now what happens here is there is elastic arteries, if you know, arch of aorta is the most common site, and that is elastic in nature. But here everything changes into fibrotic. So there is fibrosis and also stenosis, and because of that thing there is all the clinical manifestations that you see. So the blood supply is compromised, right? So the arch of aorta, when it contracts or relaxed, there is movement. So earlier it was elastic, but now because it's fibrosed, the movement is not generating a pulse. So it's a very diminished pulse. That's why it's also called a pulseless disease. So if you go for a carotid pulse or a femoral pulse or a radial pulse, the pulse is not feel or felt, right? So it's also called a pulseless disease. Again, now because the carotid artery is not getting the blood, and it's diminished blood supply, it's to the cortex, cerebral cortex. There is again diminished blood supply to the central nervous system, and again the neurological manifestations because of it. For example, syncope, like temporary loss of consciousness, or also blindness, right? Ocular problems and other different things. Also, there is occurrence of Steele syndrome when the left subclavian artery is, getting blood from the Willis circle. It's trying to get more blood because the hand's not getting blood. So the blood supply is compromised to three parts mostly: head, neck, and the upper part of the body, right? So all the clinical manifestations like that. Now what else you will see? It's a giant cell disease, or it's a granulomatous disease, again to be classified. So granulocytes are seen, they deposits, so macrophages, cytokines and all. So there is inflammation, so fever for sure, you'll get to see fever. In histopathology you'll see macrophages and different things, and also ESR and different things. Now the classical way of diagnosis is, or the gold standard is, a CTA, computer tomography angiography, or an MRA, magnetic resonance angiography, with contrast so that you can see the stenosis where it is, and you can find out what to do. Again, clinical manifestations also have hypertension. Because of diminished supply, the renin system gets activated, and hypertension. So all these things put up together, you have to check for that. And if you see the women is less than 40, it's usually a Takayasu's arteritis, named after the professor who found about this, the Japanese professor who found about this disease. Now, what to be done? Usually, the patients are put on corticosteroids, yeah, or otherwise methotrexate. And in the cases where revascularization is indicated, we go for a balloon angioplasty. In Steele syndrome, we can also go for stenting. So again, angioplasty of different kinds. So Takayasu's arteritis, I think I've said all the important things. And if you like my work and like whatever I do, please do support. Dr. Rajiv this side. Thank you so much. Stay safe, stay happy, healthy.